I'm happy to hear that there's a focus on safety. And I'm happy to hear that there is talk of engagement with social services, not just police, BIA, those sorts of parties. I am concerned that there were no social services that were asked to participate in today's press conference, the ones who are participating. I'm concerned that there were no social services who were asked to attend the press conference. I'm not sure how genuine that conversation is if those social services are not being invited to the press conference. I'm also really concerned that there was no conversation about how people who are experiencing homelessness, who are using drugs, are going to be kept safe. There was a lot of discussion about safety as a whole. But one of the things that we know is happening right now, one of the biggest safety concerns in our community in Simcoe, Muskoka, and Barrie particularly, is the amount of overdose deaths we're seeing as a result of unregulated and toxic drug supply in our communities. I mean, death is probably one of the worst safety concerns I can think of, and I didn't hear any conversation about what harm reduction measures we're looking at putting into place. I didn't hear any conversation of the CTS application or the SCS application, and how anyone around the table in terms of that press conference are going to be supporting
You're referring to the safe consumption site.
The safe consumption site, yes, sorry. So the CTS, the Community Treatment Services, through the provincial government, or more broadly known as SCSs, which are supervised consumption sites. And so we know there was a lot of conversation about data-informed practices and evidence-based approaches. We know through data and evidence that supervised consumption sites save lives. They reduce social disorder, especially where there's already a high amount of public drug use, often as a result of homelessness. We know that that evidence is available, and unfortunately I didn't hear any conversation about that.
That was one of the questions you wanted to ask.
That was one of the questions I wanted to ask. I know we saw just recently, March 31st, Sudbury, who, like Barrie, had received federal approval but not provincial approval. So the federal approval allows for the exemption to the criminal law, and the provincial application allows for the funding of the SES. And so while we're all waiting for the financial aspect to be supported, there are communities who have allowed and supplied financial resources to communities to be able to enact supervised consumption sites. We saw that in Sudbury. Unfortunately, they weren't able to continue, and as a result, since March 31st to today, what date are we? May 23rd, there have been an unprecedented amount of overdose deaths as a result of the closure of that SES. And so there is a rally, there is a provincial rally that's going to be happening at Queen's Park in Toronto on May 28th that we are endorsing because we need support, we need commitment to real safety, we need commitment to saving people's lives, and those lives include people who use drugs. And so we're hopeful that talk of community, talk of social services, talk of safety means that we can begin to have some of these conversations, but I am apprehensive until I see action behind those words.
And one thing Mayor mentioned was everybody is equally affected by the drug crisis.
So I think that I don't want to make it seem like any group is more likely to use drugs because there's something inherent about that group using drugs. What we know, though, is that problematic substance use and substance use that people, they themselves may not want to continue to participate in, but do for coping, for a lack of medical health access, those kinds of things, are impacted directly by racialized communities. So we know that racialized communities are more likely to experience social isolation in communities, and that has a direct connection to problematic substance use in community. And so I do think it was pretty disingenuous or maybe just uninformed to say that there is no connection to racialized, specifically Indigenous community. We see a lot because of the impacts of colonization and intergenerational trauma. We do see an increased use of substance use, and we see an increase we see more homelessness and houselessness in communities because of how those communities have directly been isolated, how those communities have had their resources and access to opportunities removed based on those racial identities. And so I think to say that there is no connection was disingenuous at best. I didn't actually have any expectations coming into this. I just found out about it at 8 o'clock last night, something like that. And so I honestly didn't have many expectations. I wish that there would have been conversation and talk of commitment to harm reduction practices. I wish that there had been more realistic measures to address the housing crisis, even from a bylaw perspective of how people are able to access safety and deeply affordable, meaningfully affordable housing in our community. While I think that the Rose Street initiative is a great start, it is nowhere, there are not going to be near enough units to address the amount of homelessness and houselessness that we're seeing. So I wish that there had been more conversation on that and more meaningful action taken so that we can address houselessness and homelessness, which is the root cause of the social disorder that people are concerned about.